So thank you for joining today. My name is Yvonne Blanco. I am a broker sales manager here at Insurance Advisors Direct. Today we're going to go over Molina's highlights for Ohio and Michigan. And we also have a state map. So brokers, keep in mind Molina is nationwide, not in all the states, but we're going to show you where Molina is available. We do have those contracts available. So please, reach out to myself. During the presentation, if you have questions, please type them in the chat box, and Latoria and myself will go ahead and answer those, accordingly. And thank you so much, Latoria, for joining me today. And I hope that brokers can take away, some of these highlights, how we can help the community, and, be able to provide these services.
Absolutely. Thank you for having me. I am Latoria Whitfield. I am the broker channel manager here in Ohio, and I am currently covering Wisconsin as well. And as Yvonne said, we are in multiple states. So there are some slides here that'll show you the different states that we're in, and we'll go ahead and get started. So this is our national footprint. So this gives you an idea of where we currently are, and we are actually expanding more in 2022. So that is something that we're excited about. Those things will be coming out in July, August. So depending on when you're looking at this, when you're viewing this, we may have some more states to roll out, and definitely getting excited about it. And in addition to the DSNP, we will also have some MAPD plans available. So super excited.
That
Yes.
is new. I'm
Yes.
excited.
Yeah. So we don't know exactly where yet. It's all a secret right now, but it's coming. So,
Right.
we're excited. Yes, for sure. And then, so this is our Michigan service area map. So we do have two plans in Michigan. We have the 001 and the 004. So this is just a map of where we're at, where we're located at, and kind of the difference between the two. So as people start to sell and interested in it, just be aware of which plan guide you're ordering for the according to the area that the person is actually living in. And this is the Ohio service area map. So in Ohio, we are in 71 of the 88 counties. So we're adding a couple new ones for 2022 as well. So this is a good idea of where we're currently at, where we expanded to. And again, we'll have a couple more in 2022. Also here, just to note, outside of the counties, I also put the network highlights there. So just where are we? This is up on more Northeast Ohio, the Cleveland area. This is more Akron area. This is around Columbus, Cincinnati, and one from there. So that gives you some highlights of who do we have in network, what hospital systems. And then benefits tailored to our members. So we do DSNP. This is what we do. We're aware. We know what they need, and we like to service that. Dental is something that everybody needs, everybody hopefully wants. So that's one of those benefits that we have in our plan. We also have a vision, over the counter, the PERS, and telehealth. And we'll touch on all of those a little bit more. So the over-the-counter benefit, this one is a really big one that has just spiraled over the years. And what I love about our over-the-counter benefit is it does roll. So the person does not lose it at the end of the quarter. It does roll all the way through the end of the year. So in Ohio, you get $350 per quarter, and that money rolls until December 31st. And then in Michigan, you get $330 per quarter. And again, it rolls. So it just has to be used by December 31st. And it's for different things, the home aids, cough and cold medicines, Band-Aids, just things like that. So it's a really, really good benefit. It's actually a 450-page catalog that shows you everything that you can get. So
literally, they would have about $4,200
yes
a year.
Yeah.
Okay, just to put that in perspective, that's a lot of money for them to be able to spend on those.
Yeah, absolutely. Yeah, it's a lot of money. It really is. It really actually works out good for them. It's $1,400 for the Ohio benefit. So it's a lot of money. Yeah, $1,400. So it actually works out.
$1,400. Really. Oh yeah, because I was doing it per month. Okay.
Yes. So
per quarter.
Yes, per quarter. Yes. We got you. We know what you mean. Yeah.
Thank you very much.
No problem. Not a problem. Yeah. And then, like I said, it's a catalog, so they can use the OTC actual Visa card, or they can go into the and use it into the store, which is nice. In Michigan, they can go to Sam's Club, which is really nice. And or they can do it by phone, they can do it through the catalog, through the internet, whatever works for them is fine for us. So it's just a really convenient and it's a nice benefit to have.
Wow.
Yes. And then we got the dental. So the dental, and this is for Ohio and Michigan, they get $2,500 per year. And that's for the comprehensive. So their preventative services, like the two cleanings, the oral exam, the
Mhm.
x-rays, all of those things are separate. So I know in a lot of plans, if you get a $2,500 amount, you have to separate, you have to subtract for the oral cleaning, subtract for the, for the fluoride treatments. For our plan, that is all separate. So you get all of those things separate. And in addition, you get the $2,500 for any comprehensive work.
And I have had a few brokers specifically being asked about dentures. A lot of these other plans will go
Yes.
ahead and give dental coverage, but they have an exclusion on dentures. But you
Yeah.
guys actually cover that. So can you just a little bit more specific, like does it cover the full dentures every
Yeah,
3 years?
yeah, they get full dentures or partial, and they're available every 3 years. So that's a benefit that has been extremely popular. Yeah, so they can every 3 years, and they go through Delta
Great.
Dental.
Right.
Yeah, yeah. So we have a very solid network through Delta Dental, and it's been working out really, really well. So that's a benefit that we're proud of, and definitely continue to utilize that in the future. Yeah.
Perfect.
Yes. And then we got vision care. So the vision, the person can get contacts, lenses, or glasses. Some people prefer contacts, some prefer glasses. Either way, in Michigan, BSP is the provider, and in Ohio is March Vision. The benefit for the 001 in Michigan is $200 every year. And then on plan 004 is $350 every 2 years. So just be mindful of that.
Mhm.
And in Ohio, it's $100 or $400. I'm sorry, $400 every year for vision, whether it's glasses or contacts. And the upgrades are available as well. So, I mean, if they can get a pair of glasses and the tent and
Right.
all that for under $400, go for it. That is available to them also.
I think that's important. Speaking from someone that has one, if you don't have the right prescription, if you don't have the
Mhm.
right equipment, you get headaches, eye
Yes,
strain headaches. It affects a lot of things. So
exactly.
I think a lot of especially our elderly, they'll just buy the ones that are available, over the counter. You see
Hmm.
them at the turntable, and it might not be the right ones. And how nice is it
Exactly.
that they can go get this, and the exams are zero.
Yes.
Your yearly exams are included for both, I think nationwide in any of the Molina
Yes,
vision cares,
absolutely.
right?
Yep, nationwide. Yes, exams are always included. Yes, and it really is an educational thing. Sometimes people just don't know what their benefits are. So if they know what they are, if they know what they have available, and it's just through those conversations where they're actually engaged and involved, and they can actually use their benefits that is available to them. So
Right.
yeah, yes, definitely a good thing as far as that goes. And then we have transportation. So transportation is an excellent benefit, and this is something that's really been helpful to people. In Ohio, it's 72 one-way trips per year, and in Michigan, they get 30 trips per year. And if the person goes to the doctor and needs to go to the pharmacy afterwards, that's not a separate trip. That's all counts as one visit, which is really, really
Oh,
nice. Yes,
yeah.
so they can go get all those things done. Nothing worse than leaving the doctor, having to go to the pharmacy, and then that counts as two trips. So
Right.
for us, it's one trip. They can get all of those things done, which is really helpful. And then we do ask that they call 3 days in advance, and just little things. If they need a wheelchair, let us know you need a wheelchair up front. We don't want to send a four-door sedan when we should have sent a van. So those are just things that should be obvious, but just make sure a person knows who's getting in the car, what's going to happen with that. So that's really nice. And we also have the mileage reimbursement if a friend or family member can take the person. So that's a form. They can call customer service, get that all filled out, and the family member will actually be reimbursed for them taking them to the doctor or hospital or wherever they need to go.
That's great. And to keep in mind that the brokers aren't really responsible for making sure they get the forms. This is all something Molina takes care
Oh,
of.
absolutely. Absolutely. That's so important. Yes, that's something that Molina does. We take care of it. They can just call customer service. You know, brokers, so they want to sell, they want to move on. They don't want to be involved in the customer service part of it. And we understand that. We get that. We're there, we're available. Call that number on the back of the card. We're there to help. We also have people that reach out to them. Service coordinators that reach out to them. So yeah, we are there for all of those questions for sure. And we have the PERS benefit. So the PERS, everybody remembers that as I've fallen and I can't get up.
Right.
Yes, but that's expanded now. I've fallen and I can't get up has actually expanded a little bit. It is for people who maybe they're just lonely. With the pandemic, a lot of people are just lonely. Things are different. So they can actually call that line and just talk to somebody. Or if they need to call that line and they need help ordering prescriptions, help getting the transportation set up. It's really just an expanded version of what it used to be. So it's no longer in a crisis situation anymore. It's for whatever
Oh,
the
yeah.
person may need. Yes.
Oh, I love that. And
Yes.
especially, like you said, a lot of our seniors do suffer from depression.
Yes.
It's one of these silent kind of, you know, they take over
Yes.
their daily life. And so this, I didn't know. I thought it was basically just for like 911 situations.
Yeah, no, this is something that, and I don't know if it expanded before the pandemic or how it happened, but it worked out well. And so sometimes it was just for the pure lonely. I haven't seen anybody. I haven't talked to anybody. I've been in this house. These walls are closing in on me. Where I wish I
Right.
had someone. Yeah. And sometimes we take it for granted. You know, we have people we can call. We have friends, we have coworkers, we have sisters, we have brothers, we have all these people, but everybody doesn't have that. So sometimes we just have
Right.
to take a step back and say, hey, everyone doesn't have somebody they can pick up a phone. So, you know,
Right.
talking to that person on the phone can be everything to them. So I love that benefit. I love that, you know, if it is just for I've fallen and I can't get up, that's great. But if it's for that person that just needs to hear another human connection, that's great too. So it's available for either one.
That's great.
Yes, yes. Yeah, so that's really a good thing. And there's no need for a landline. So many people do not have a landline anymore. So that's okay.
Right.
It's for landline, cell phone, Wi-Fi, internet. It can cover it all. So that's really a good thing also. And this is just a little bit more about it. It is available to acquire qualifying members, and you do need a prior authorization. But again, that's just something that a care coordinator could take care of. So definitely a great benefit. And then Teledoc. This is for non-emergency care, and it's available. It says during the pandemic with zero copay. It is still available with zero copay. Again, this is one of those things that if a person can't get out or doesn't want to get out, whatever the case may be, some people were very afraid to leave the home. Some people just didn't want to leave the home. Whatever the case may be, they can do a Teledoc. So obviously, if they think they're having a heart attack, this is not the desired location that they would want to
Right.
call into. But if it's just, I have the sniffles, I have something going on. The other day, the lady said she felt like she had poison ivy. She called the Teledoc line. They looked, she really did have poison ivy. They called in a prescription. She went and got it, and all was well. So things like that,
Oh,
it can actually, yeah. And I didn't even realize it, you know, so many different things it could be used for. But yeah, poison ivy, that was the first time I heard that one. And, you know, just they looked and they said, yep, you got poison ivy, caught her in something, and she went and picked it up. So Teledoc is just a nice thing to have available if you can't get to the doctor, don't want to, whatever the case may be. Teledoc is a great benefit, and it's 24/7.
that's great.
Yes. And then our fitness benefits. So we have Silver and Fit. And I always tell people just put in a zip code and see who's on there. You know, a lot of times the person that they want is right up the street and it's right there. So yeah, don't guess, don't try to, you know, yeah, they're in network or no, they're not. Just check it out, find out if they're in. And a lot of times people are open to different places. So there is no cost to the member for the Silver and Fit. And this is some of the highlights of who we have. So
A
this is
lot of
a
these
great benefit.
places I've actually noticed they have, senior classes. A lot of them are
Yes.
in this water aerobics because
Yes,
it
that's a big
alleviates,
deal.
that pressure from their joints.
Yes.
sometimes they have this great idea, I'm gonna go to the gym, but it just takes once to go.
Yes.
And a lot of them won't go because maybe they don't have the transportation to get there. Maybe they
Yes.
don't have the swimsuit or whatever it is, right?
Yes.
But like you said, once you go in, the YMCA is a great place to go. They
It
have a
really is.
lot of
There's
different
so many
benefits.
things. Yes, it's so worth it. And sometimes, again, it's that let me just get around someone. I might not have any family. I might not have any friends. Let me just get around some like-minded people, some people that are getting out, let me just have the conversations. Let me join the class. The class might not be that hard. And then they do make accommodations, so there's different things. There's even
Right.
a weightlifting class where they do it sitting down. They're actually sitting in chairs and they're lifting weights. So don't be intimidated by it. It could be something that could really be enjoyable for sure.
Excellent.
Yes. And now this is for other people. This is something else we have. So again, it's through the Silver and Fit. But if a person can't get out for whatever reason, maybe they live too far out or they're just not able to get out, transportation, whatever the case may be, they will actually send a strength kit to your home. So you get the Garmin band and you get some weights and a couple other things, and you can actually you
Wow.
get a yoga mat, you get several things, and you can actually work out from home. So for the person that is just not convenient or just not comfortable, whatever the case may be, this is also available. So I think this is a great benefit just overall. I think people really enjoy it as well.
And that activity tracker, does that something that Molina kind of keeps an eye on?
I don't know how much attention we pay to it. I'm not even sure. That's a great question. What it's really, I think the member gets something out of it. It tracks their steps. They know what the steps are. They know what's going on. But that would be something that would be like, hey, if we could even have something to pay attention and create something around that. But I'm not sure if we pay a whole lot of attention to it. I think it's more for them to see, okay, let me try to get my 10,000 steps or my 5,000 steps or whatever the case may be.
Wow,
Yeah.
that's really nice. That's
Yes.
good to know.
Yes, for sure, for sure. And then the hearing benefits. So there's over 5,000 locations nationwide. We do use Hear USA. You can go to hearusa.com, Molina, to find a provider. You get an exam at no cost. They can order their hearing aids. And basically, they get a choice of 10 aids from manufacturers. So I know some people say you can have option A or option B, or you can have
Right.
$750 or whatever the case may be. For us, here's the 10 to choose from, and it just depends. Everyone likes something different. Some people might like the little one, some people might like something a little bit larger, whatever the case may be. So, yeah, and they get the fitting. Then they also get the follow up visit. So, if there's any fine tuning or anything that needs to happen after that, they do that as well. And then they get the service warranty and a supply of batteries also.
Now, the supply of batteries, is that for the 2 years?
Yes, yes, they get a supply of battery for 2 years. Yes.
Wow.
Yes, yeah, which is really nice. I mean,
Yeah.
that I think that's just a great benefit. So yeah, definitely a good benefit there. And then we have, I guess that's it. I guess that was our last slide. So this is the key contacts. Again, I am Latoya Whitfield. My phone number is area code 330-418-9262. And there's our broker services team. So broker services is for all your needs, whether you have questions or you need your ID number or you just want to, what's the status of this application? Is this person on Medicaid? That's another thing I did mean to mention. We do accept all levels of Medicaid. So that is something that's important that I do want to make sure I touch on. So all
Yes.
levels. Yes.
And also, isn't it people that are on the LIS can also be on your dual product as well,
Yes.
right? On
Hmm.
those
Hmm.
levels?
Yes. Yes. So we do take those absolutely. Yes.
Which is, just to point out, the only plan that literally takes all the dual or the Medicaid levels and all the LIS levels. If you have questions on what those levels are, what the Medicaid levels are, or the LIS, please reach out to me. I have charts for our brokers, but Molina is the only carrier that will allow people to be on their dual plan on any of these levels. So I just wanted to stress to the brokers, especially if they're new on writing any dual products, or someone that is on extra help or on Medicaid. Molina is so easy, and they know how to take care of questions. how to handle this population with confusion or a lot of health issues. It's just kind of the go-to if you're really starting out with this kind of population or dual products. You know, the trainings are very simple, the online apps, if you want to do it that way. But again, all of these benefits that we kind of went through is, I think people are missing out all that is provided to somebody that's on Medicaid. And a lot of people, I think one of the biggest things, and I don't know if you've heard this, Latoya, where brokers, you know, they get this feedback from their people, like, don't touch my Medicaid. Don't touch it.
Yeah.
Don't affect it. No,
Yeah.
I don't want you to be, I don't want to be on this plan because you're messing with my Medicaid.
Yes, yes.
You get a
And
lot
it's
of that.
not the case. Yes, yes, I do hear that a lot, and it's not the case. And I think that what that is it's just it's a misunderstanding. They don't know, they don't understand what benefits they can. So again, that's another one of those educational pieces. This is what you get. We're not taking away anything from you. We're actually adding value. We're giving you some things. So yeah, if a person can get past that barrier and understand that's the key to getting more of what's available to them already.
Right. And Molina has some great, once you get contracted, you guys have great flyers that show these highlights.
Yes.
And it'll have the broker's information. You can pass those out at community centers, food banks, maybe some of the other community kind of, they'll help with like maybe with their electricity or their rent or some of these network that the city might provide or even the state provides, to be able to kind of partner up with them and provide those flyers.
Absolutely. And we do those flyers at no charge.
Exactly. And it gets
Yes,
mailed to the broker right to your home.
exactly. Yes.
Yeah, and I just wanted to stress, you know, when again, you know, everybody's going to know someone in their 360 that's going to be on Medicaid or extra help.
Yes, for sure.
And a lot of people will go ahead and be on a regular HMO plan, or, you know, they put them on because they're going by a name. They're
Yes.
used to this carrier's name. They,
Mhm.
you know, it's been in the state, but they don't realize all of the benefits they're giving up.
Yes, yes. And it's so discouraging. So that's why we always tell people, talk to people, have the conversation. Don't be afraid of a person that's on Medicaid, because if you educate yourself, you can educate them, and then it can be just a win-win for everyone.
Exactly, exactly. And like I said, a lot of because Molina knows how to handle you know, dual products, questions that come from this you know, people that are really sick or maybe didn't even pay attention to that before. Since Molina is pretty much as far as I know here in Michigan and maybe even in Ohio, they're the I guess the longest dual SNP carrier product here in the state.
That's
Um,
excellent. It's not here in
historically,
Ohio, but that's great for
it's not,
Michigan. I never knew that.
yeah. So they've been around as far as the dual products, you know, with a national presence, this kind of impact here in Michigan as far as duals. So they know what they're doing. And obviously as a broker, you know, you might spend 2 hours and thinking, oh, these people are going to switch and stuff, but you're partnering up with Molina. And since you guys know how to handle this, how to take care of these members, you want to put them in a plan that's going to I guess, support your stability on your book of business.
Absolutely. I totally agree with that. And thank you for that. We love hearing that. That's always a compliment every time we
Yeah.
hear it.
Yeah, thank you. Now, I think the next, so you are definitely Ohio and Wisconsin.
Yes.
Fran wasn't able to be with us today, but she's new here to Michigan. Hopefully we'll be able to introduce her.
Yes, yes, Fran Dennis, and her phone number is 248-270-0425. And yes, Fran is new to Molina, but definitely not new to Medicare, definitely not new to the business. I believe Fran has over 25 years, just a wealth of knowledge, a wealth of information, somebody that's really, you can really get behind her and understand, and she understands the broker. She's been a broker. She's been on both sides. She's run captive departments as well as broker departments. She is someone that you want to connect with, and she has a wealth of knowledge, and new people that's been around either way, she's going to give you something that you haven't had before.
Right, whether you've been an experienced kind of seasoned broker or
Yes.
just barely starting fresh.
Exactly, exactly. Fran definitely has some insight that can help you either way. She's a good person to be around for sure.
Great. I'm so excited to get to do more events with her and get to be able to do some trainings with the brokers that'll be coming on.
Absolutely, yes. And then our this is our Molina broker training link. So just a couple things. The onboarding, obviously they can contact you if they want to go ahead and contract. And the onboarding, the Molina formulary, that's just for the prescriptions and everything to see what level each prescription is on. The PCP finder pharmacy. The DRX enrollment, so that's how a person would actually enroll. Our online enrollment has been very, very easy to use. So that's a compliment we always get. And that's the 17-minute video that a person can watch. And
Great.
evidence of coverage and the scope of appointment can be done online or by phone as well. So yeah, those are some training links a person can go through as well. And
Great.
then the last one, that is you.
And that's me. So if you have any additional questions, would like to know a little bit more about dual products, LIS, please reach out to me. Obviously, my phone number 248-946-4640, extension 124 here at Insurance Advisors Direct. I wanted to thank Latoria again for joining me and doing this nice, short and sweet highlights on Molina. And to all the brokers that are attending, hopefully I can hear from you soon. And please keep an eye out for our Friday webinar series here at IAD.
Thank you.
Thank you so much.
Bye-bye.
Hello again, it's Yvonne live. I hope you got something out of our webinar. And I wanted to go ahead and just share the screen of our contacts. For some reason, the actual, let me just share that so you guys can see the contacts. The slides didn't come on, so I emailed them to everybody, and hopefully you guys were able to follow along with that. Again, if you have any questions, I think I have a couple of questions in our chat box. So let me just go ahead and see in there. It says here, we have a question. Do they only have hearing aids with batteries, or can members purchase aids with that utilize a charger? Yes, they have over 70 different types of hearing aids that they can choose from. Some of the other carriers only have like 1 or 2 or maybe 5 that you can choose from. Molina's, I guess their products that they can choose, they can do the ones that are, you know, have the little wire, or the ones that you just kind of looks like a little bean you just put in your ear. You can, they have so many, and it's in a catalog for them. So this was Latoria's contact. Here's Fran Dennis. Fran Dennis is the new Molina broker manager here in Michigan. Again, I'm going to go ahead and send this. I believe I got everybody this flyer or these PowerPoints to their email, so those links are there provided. We have one more other question. Let's see. Do you have an online way to verify what level of Medicaid someone is on? Now, for Molina, you would call their broker services team, and they would go ahead and tell you what level that member is on. There is another carrier that you can actually check on when you're in there. And so I will go ahead and reach out to you, Otto, and let you know which carrier that is that you can check on an online, you know, in your portal if that member is on Medicaid, and it won't tell you the level. It'll just say that they are qualified. Molina will actually tell you the level. So I would encourage people to go ahead and call their broker service team. Well, and then of course, there's my information. I want to thank everybody for taking the time to listen about Molina. Again, if you have questions about Medicaid, extra help, or any of the carriers that provide these products, please reach out to me. And thank you, and have a great weekend. Stay safe.